Well, hello, I am MC Ruchi and we have our Dr. Saubarnika with us, and this is my third session for laser hair removal.
It was at this moment that he knew. He fucked up.
It's not laser hair removal, it's laser hair reduction.
Reduction, yeah.
So it only thins the hair.
Okay.
It will be like in my skin you can see there is hair when you touch it, but you won't see it from here.
Got it.
The laser hair reduction in SkinC works like we are using the 4-wave technology which targets the hair. The root of the hair contains melanin, the black color pigmentation. It absorbs the pigmentation at blast. So gradually the root will get smaller and the hair will get finer. So according to each session, it will get thinner and thinner, and you will see the density also getting reduced, and then the hair will be like very small, which is not visible in a naked eye.
My hairline, I wanted to reduce it. Is it safe? Like, what happens if it's done?
It's near your eyes, right? The heat will get past. You might get irritation in your eyes. It might affect your visibility of your eye.
Oh.
So it's not advisable to go above your eye level. Your side locks, chin, upper lip, around your nose, everything is fine. Not above your eye level.
Which is the most painful area?
Bikini and the upper lip. The upper lip, it will be a little painful, but bikini, certain people have to tolerate. It is according to the individual's resistance. Here we use numbing cream also, so they
Okay.
can tolerate the pain.
Okay, but it's okay to go with numbing cream. There's no like,
that
side
does
effect.
no any side effects. It just localize the area. The localized area will alone get numbed, and then you can give.
Understood.
Even the cooling technology we are using for -9 degree, that also numbs the area.
Okay.
So when the shot is given, you don't feel the heat.
Yeah.
That
True.
is why.
Got it. So now, what is the reason why bikini area and upper lips feel more painful than
It's
the
very
rest?
sensitive compared to other area.
Okay.
The skin there is very thin, no? That is why.
Okay.
In upper lip also, in this area you won't feel the pain, but this area you will feel the pain more.
Yeah.
That is why.
Got it.
But as in lower lip, you won't feel the pain. This area is sensitive. That
Got
is
it.
why.
Understood. Next is the process related to the treatment. So, like, what is the procedure like once I enter the clinic?
We'll move to the clinical room where first they'll just apply cleanser plus moisturizer, and then they will mark that area.
Yeah.
And then the entire area will be raised. Before that, the picture will be taken and sent to the doctors. And in the first session, we'll go with basic to see your sensitivity and your tolerability. And then the first session you will feel slight heatness and pricking and everything. After entire area is covered, whichever area you are interested in or you are interested in entire body, everything is covered. Your laser shots will be over, and then again they will clean. They will apply moisturizer if you're going out, and sunscreen. That's it.
Got it.
Like therapist is the one who are eligible to do LHR. If the doctors can't do like every LHR, right? So we'll have a dermatological trained therapist especially for LHR.
So, what is their designation?
They'll be from the medical background,
Okay.
basically cosmetological background or any medical background.
I'm coming here for my full body. So, how many sessions would it require?
Minimum of 8 sessions to see the 90% reduction, but for certain individual the hair will be thicker in hand, thinner in legs. Comparatively, your own body won't have the same length of hair, density of hair, and the thickness of hair.
Yeah.
So you might need additional sessions, or you might need a maintenance. That is like compared to every individual, it's different.
Okay, so minimum is 8 sessions for
Yeah,
full
minimum
body,
is 8 sessions for full body.
and maximum is subjective to your body type. Let's consider 8 sessions. Now, you mentioned the first session is a bit painful.
Yeah.
You check the tolerance. So, will the pain reduce after each session, or will it increase, or will it
You
be?
will get used to it actually. Then when I increase the frequency, you will feel the pricking sensation, not the pain. you'll just feel the pricking sensation in the certain areas which is sensitive.
The super important thing, what is the pre-care? Like before I do my first session, what all things do I need to keep in?
Minimum of 50% of hair growth should be there, so that I can see the area which is grown and which is not, so we can mark that specific area and give the targets. And before entering into the clinic, you have to moisturize your skin, your entire body. You have to apply moisturizer regularly after your first session.
Okay, so two things before my first session is I need to have hair on my body, like 50% of
Yeah,
hair,
50%.
and moisturizing my entire body.
Yeah.
What is the post care, like things that we need to keep in mind after the session is done?
We'll give you the post care which you have to follow. You have to use 3 times sunscreen before 5 p.m. You have to use 9 a.m., 12 p.m. and 3 p.m. And then you have to moisturize your skin regularly. You have to use the Moment F cream and the Moment F lotion in your face, bikini and on your back also. You have any itching, you have to use the Kelosoft lotion also. And for certain time, for 24 hours, you shouldn't use hot water, and you should avoid swimming, jogging, gymming and everything, so that you don't sweat for 3 days. That is for 3 days. And then you have to avoid waxing and bleaching in between the sessions also.
Okay. And apart from that, we have no makeup as well.
No makeup, no any chemical agents, no deodorants, no any actives on your skin also.
What would be the gap between my first session and the second session?
Most people will have 4 to 5 weeks.
Okay.
Those who are like having the good results for the first session itself, they will be having like 20% of the people will have 6 weeks, but 80% of the people will have 4 to 5 weeks. But in second session, the days will get increased.
Yeah, because my hair growth will not be that good.
Yeah.
I am an MC, and between my first session and the second session, I might have events to take up, and I have hair on my body, so I need to shave. But then, should I be waiting for hair to come back before my second session, or what should I do in that case?
If you're waiting, that is fine. You can take a picture also before
Okay.
shaving. That would be helpful for the doctor to analyze after how many days the hair has grown, and in how many days how much thicker it has gone.
Okay.
And we can compare. As you know, we have your before and after
Yeah.
pictures. It would be easy for us to compare how is your result proceeding to your how is your treatment proceeding to the result.
Got it. So before I can go to an event, I can shave, but I need to take a picture before
Picture, that is like we
Understood.
have to see the pictures, you know.
What if I have a tattoo? Will it be okay for me to do the session?
No, if you have a tattoo, we'll cover it with a micropore tape. Basically, the laser targets the black pigment in the hair follicle, right? So the tattoo will be also the same. So we'll cover it with a micro tape, so that you don't get any irritation or burns in that area. The tattoo area will be completely avoided.
Okay. So like you mentioned, it targets the dark pigmented hair follicles. So if you could help me know in detail, like does it affect my organs or my cells, or how is the procedure like once you put the laser on my skin?
And it only targets the black color pigment which is located in your root of your hair.
Okay.
Okay, only that is getting targeted, no other hair cell is getting targeted. The hair follicle will get smaller gradually as the session is increased.
Okay. So one of my friends, she's like, no, I'm not going to do laser because it can cause cancer. So what is your take on that?
Like there is no any evident result that laser hair is causing cancer so far, so you don't have to worry.
If I have a cut, then how do we
That
go
area
ahead?
won't be done, we have to cover it, or else we have to postpone the session until the area is getting healed.
Okay.
If we can't give any wounds or any infection is there, you have an acne, something like that, we have to avoid that
Okay.
area.
Is this hair removal treatment permanent, like no hair till you die, or you get hair in this lifetime?
After certain age, during your menopause, especially women, during their menopause, no, they might get this hormonal imbalance. At that time, you might get hair growth, but not as before you had.
Okay. Minimal.
So, minimal.
Okay.
That is how.
And one more question that I had is the result different for different people, maybe with respect to the skin type or hair type?
Yes, for fairer people and compared to dusky people, the fairer people will have the highest frequency compared to the dusky people. Dusky people with the lower energy itself, they will get good results. For fairer people have to increase little bit for the melanin to get absorbed.
But the effect.
Effect is same, the result is the same, everything is same.
Understood. And let's say somebody has thin hair and somebody has thick hair. Like I have thick hair growth. So will the result be different for the two of us?
The thin hair might need minimum session compared to the thick hair, because in thin hair, after 2 sessions itself, they will see the spacing, the gapping and everything. But thick hair, we have to reduce the thickness of the hair, and then the spacing, it has to go gradually. You might need 1 or 2 sessions compared to them.
Okay, the number of sessions vary because of the hair type.
Thickness
but-
of the hair.
Okay.